Can you hear us?
Oh, there you go. I got you. Good morning, Janela.
Good morning. Good morning.
Let's just get right into it, as time's always so short here on the
Sure.
show. So, can you, if you could, we'll start with the wrap up of the weekend activity with the rapid engagement team, and then what are they looking at doing today?
Sure. So on Saturday, we had a community outreach at the Yigo gym. So just point of clarification, it wasn't actually part of our rapid engagement team. It was just a regular outreach that we did at the Yigo gym. We had initially 200 registrants. We had about 155 swabs, and out of that, 33 were positive. And then we go back in today to the subdivisions of Gilbaza and Zero Down. We weren't able to complete the mission on Thursday and Friday. So we go back in today to complete that. Hopefully we can complete it today. And if not, we'll go back in tomorrow if necessary.
For the positives from the first 2 days of the rapid engagement team's
Deployment.
deployment. What happened, or what happens to those who test positive? Did you guys ever decide or about whether or not they were going to be sent to an isolation facility or if they were going to isolate in place?
Sure. So for the first day of the 40, out of the 48 positive cases, 2 were successfully transported to the isolation facility. 40 of the 48 were successfully isolated at home. And then we are assessing the remaining. And then for the second day, we also are assessing their home situation. Let me just pull up my notes. And then I believe, actually, so 74 of the, so it's 81 total, right? For the 2 days, 74 of the 81 were successfully isolated. The remaining 7 are one household unit. 2 of them are in the isolation facility. So those were the assessments that were made by our containment and isolation team. And so I just want to point out that, isolation doesn't always necessarily mean that we take every individual into the isolation facility. Because we assess the suitability of their homes, and if they are suitable, we're able to successfully isolate them at home. And in some instances, it might actually be better because there may be multiple positives at the home. Like in one instance, there were multiple positives, like 7 positive cases in one household. Then it would be better for them to just isolate and treat that home as its own isolation facility.
Is that what you guys were finding? A lot of households where there were multiple positives?
It really depends. So like in that one, it's like, as I mentioned, in that one instance, and we were sort of expecting that there may have been multiple positive cases in one household. So we would just treat that house, that one home, as an isolation facility, and of course monitor that home going forward.
Teresa Philippin, she was just on a little bit earlier, and she did talk about the outreach, the separate outreach that was held at the Yigo gym, but she said she was also working with public health on 3 more outreaches. Can you tell us anything else about that?
Well, our team has been working with the FSM Consulate Office and the FSM Association of Guam to discuss more community testing. We haven't, I'm not sure if we've actually identified more locations, but we are going to look at the evidence. We're going to look at the data and, look at the need for intervention, other areas, especially after we've completed the rapid engagement team outreach at Gilbaza and Zero Down, because we have 2 separate sort of parallel projects that are ongoing right now. So we have the rapid engagement team, and then we have, other types of testing that are going on. So the rapid engagement team is sort of different because what we do is we go into subdivisions, into villages where we set up a mobile lab. Our team goes out, they go to the homes and they test at the homes. And then we have, similar to what we did in the Yigo gym, where we have the drive-through testing. So they run parallel, but the mission is the same. Mm-hmm. We try to capture as many positive cases, contain that spread. So we are working with Teresa Philippine, the Consul General, and then we'll identify the areas where we need testing to occur.
Janela, we got a message from a lady who tested positive on Friday, said she was told that there's a wait list for the isolation facility. Is that accurate?
Yeah, so, we have right now, early on in the pandemic, when we were only seeing low numbers of positive cases, 2 to 3 a day, sometimes no positive cases a day, it was a little easier to handle how many positive cases we had and being able to put them into the isolation facility. Now that we're seeing, 40, 50 a day, sometimes 80 to 90 a day, and 900 to 1,000 active cases, it's a little bit more difficult to manage how many active cases we're isolating. So our isolation facility at the Bayview is full, but we are working on, for the rooms that are dirty, we are working on cleaning and disinfecting those rooms so that we can make those available. And at the same time, we are working on opening up a second facility so that we can make room for more positive cases, should we need room for more positive cases. So not necessarily that there is a waiting list, but that we want to make room for more positive cases because we are seeing an increase in positive cases. So we are working on opening up more room for individuals.
So how many people are on the wait list?
As I mentioned, it's not necessarily a wait list, but our isolation facility at Bayview has room for about 125. There's 125 rooms right now. We have 89 individuals in there. And we are currently in the process of cleaning out 24. And then we're opening up a second facility, and that's Garden Court or Ocean View. And that has about, I believe, over 140 rooms available. So once we get that one open, then we'll be able to move positive cases in there. And again, these are for individuals who may request it, or if we see that their home is not suitable for isolation, then we'll be able to transport them to the isolation facility.
How long does it take to clean the dirty rooms, to sanitize them?
I'm not too sure, but hopefully the turnaround time is really just within 24 hours. Mm-hmm. And it's multiple rooms, right? So I don't know what the turnaround time is, okay. But we are working on getting those 24 rooms available as soon as possible.
Mm-hmm. And so the RFP is out then for the additional isolation facilities. We're just waiting for the contract to be signed?
That's right.
Okay. Yes. And we did talked with Chief of Police Steve Ignacio earlier today, and he mentioned that there was another incident that occurred at McCrout's down south. Can you provide additional details about what exactly happened? He said that a notice of violation was issued.
The notice of violation, I'm not clear on the notice of violation. Our team did go out. We've been getting multiple complaints about McCrout's. So our team did go out. We've actually gone out, I believe it's 4 or 5 times now. On one instance, it was just driving by just to monitor. But we've been getting multiple complaints about McCrouts. We are working with the management of McCrouts. For the most part, they've been compliant with the exception of just a few violations that we've observed. And one of them was that their outdoor dining space, the tables are not within 6 feet. And some of the tables had more than the recommended 5 chairs within one table. So they corrected that on the spot. But you know, they are working with us. They did submit their organization specific plan. However, it wasn't within the recommended guidelines that we established. So, you know, we're receiving these complaints, but every time we go out, we let them know, you know, these are the guidelines, these are the recommended guidelines, and they are willing to work with us. Other complaints that we received are that, you know, there's noise. I think, you know, the area where they're setting up their outdoor dining may be encroaching upon private property. So those are some of the other complaints we're receiving. So I think it's just educating them on what the guidelines are. And the other thing too is, you know, we're working with the AG's office as well to get further guidance on what our authority is as far as being able to close down a restaurant. Because at this point, our authority is limited. So we may not just be able to close down an establishment. Another thing I want to point out is, you know, there are multiple restaurants and our inspectors are out there, you know, conducting inspections, visiting other establishments as well. So McCrouts isn't the only one that we're receiving complaints about.
What are some of the others?
I don't have the full list, but we are regularly doing inspections.
Right.
Other than just receiving complaints, we do regular inspections
Right.
to ensure that establishments are complying with the executive order.
Wow. You don't think McCrouts knows by now what the protocols are? Because it just kind of, I mean, I just feel for small businesses that have spent a lot of money to become compliant so that they can operate under these conditions. And then you have other businesses who clearly they know. I mean, how could you not know what the protocols are? And it almost seems like we're working a little too well together with these businesses that continue, in my opinion, to just flout the rules. And I mean, there's a virus out there. It's killing people. Infection is widespread. Why aren't we being more serious?
Sure. And you know, and as I mentioned, we are getting guidance from the AG's office because, you know, there's a section in the policies where the sanitary permit. So basically, we want to know if we can use the public nuisance aspect to be able to tie that to the sanitary permit and suspend the sanitary permit. And that's specifically what we're asking the Attorney General's office. If we can use public nuisance as sort of so if we have the ability to say this public nuisance is, if we're able to use that to suspend your sanitary permit. And we don't know yet at this point. We've used it in the past, but we want to ensure that we're able to do that at this point in the pandemic. You know, as far as whether or not they know, we've admonished them multiple times. We've told them what the guidelines are. The guidelines have been published. When we first visited them, and even the second time we visited them, we told them that, you know, you need to submit your organization-specific plans. This is what they are. We told them you need signage. You need to advise your patrons that they need to wear masks, social distance. Your tables need to be 6 feet apart, no more than 5 per table, no more than 5 chairs per table. But, you know, there are repeat violations. So we would hope and we would think that they would understand what the guidelines are. But public health is there to you know, guide them and to educate them. But we are working with the Attorney General's office and waiting for that guidance from them as well. So hopefully we can get that soon.
Okay. I'm just wondering why the guidance wasn't requested before, you know. Like you would know, okay, this is what we can do, this is what we can't do.
Yeah.
Well, as I mentioned, we did have that policy. We did use that policy in the past.
Right.
But in light of the many challenges that we're facing, we want to be sure that what we're doing is the right course of action. So we don't want to make any mistakes or be, we've been taken to court multiple times. So we just want to make sure we're taking the right action.
Okay, Janela.
Okay.
Thank you for your time.
Thanks.
And maybe
Sure.
I'll message you. Maybe we could get someone from environmental health on to kind of expand a little bit on the inspections and the hard work they're doing.
Sure.
Okay.
I'll talk to my team and see if we can get somebody on for you.
Thank you,
All
Janela.
right. Take care.
Grab some virtual empanada on your way out.
Okay. Thank you very much.
Right,
Have a
okay.
good day.
9:09. Let's keep it in the K-Wave News Zoom room where we have our Monday morning hospital update with hospital administrator Lillian.